Welcome, Spencer.
I'm going to start off with a question. How many of you have had a glass of water today? How many of you would have been willing to walk over a mile for that glass of water? What if I told you that glass of water you just walked a mile for was filled with parasites and diseases? These are problems that men, women, and children living in Honduras face each and every single day. By the time I finish today, between 10 and 15 children alone will have died in Honduras due to water-related illnesses. The Remote Village Project has been working since 2005 to help alleviate this problem. I'm here today seeking donors and volunteers to help us one day reach our goal of serving 20,000 people with clean water and basic sanitation. As some of you may know, in 1998, Hurricane Mitch devastated the majority of Honduras. It left 20,000 dead, many more injured and sick, and left over 60% of the country without clean drinking water. The Virginia Hospital Center Medical Brigade, in response, sent 35 doctors, surgeons, and nurses to provide medical care to those who cannot otherwise afford it. This marked the first annual humanitarian healthcare mission trip. In 2005, in response to a question that some of you may have right now, what about the other 51 weeks of the year, the Remote Village Project was created. With the help of the Lions Club of Comayagua, the Remote Village Project adopted 3 main villages in the mountains surrounding the Comayagua Valley. In these villages, health clinics were developed and are currently staffed by community leaders trained to act as basic health care providers. It was evident from the start the majority of health issues facing the residents of these villages was due to the fact that they had no access to clean water and basic sanitation. As such, in addition to treating the symptoms of these illnesses, the Remote Village Project became interested in addressing the root cause of this problem by developing gravity-fed, potable water systems to provide sustainable access to basic sanitation and clean drinking water. Now, in order for these projects to be successful, they must follow a very specific model set by the Remote Village Project. Firstly, the Remote Village Project and the Virginia Hospital Center Medical Brigade will provide all funding, project management, maintenance, as well as training for any operations needed. On the other hand, the village itself will provide all materials, transportation of materials, and the unskilled labor required to construct the systems. For the construction aspect, it begins with the legal and design phase. First, the village must prove that they have complete legal control of the land in which the system will be constructed. Once that's done, the design is created, and when the design is finished, the construction actually begins. For the construction, first, you have to find a sustainable a sustainable source of water, whether this be a river or a lake or whatever it is. Once it's found, a dam is built, the conduction line is laid from that dam to a cleaning and holding tank in which water is filtered. From there, the water is piped to every school, home, and church in the village. In order for each homeowner to receive a clean water tap, they must do 2 things to promote basic sanitation in their village. First, they must remove all trash from around their house. Second, they must construct a 4-flush latrine near their house in which both materials and instructions will be provided for them. As long as each homeowner continues to pay a monthly tariff, these projects are completely self-sustainable for an economic life of 25 years. The water is tested very regularly. Every time a member from the brigade or the Remote Village Project goes down, the water is tested to make sure chlorine levels are safe and that the water is drinkable. Today, so far we've completed 5 projects and served roughly 5,000 people in 800 homes. Currently, we have 2 more projects underway. One of them is in the design phase, and one of them is being constructed. Once these 2 projects are finished, we'll serve an additional 4,500 people. This leaves our total at, right now, 9,500 people and 1,600 homes. As I said before, our goal is to one day serve 20,000 people, and this is where you all come into play. We're about halfway to our goal, a little less, 500 less than halfway. So we need your help with donations and volunteers to help us reach that goal. Over 60% of our funding comes from private donors like yourselves. And I can guarantee you that 100% of your donation will go towards the project itself and in turn helping someone in need. If you'd rather donate your time, there's plenty of ways to get involved. You can donate your unskilled labor and just come help with the construction. If you're fluent in Spanish and would like to come help and act as a translator, most of our volunteers don't speak any Spanish, so you can either help other volunteers or get involved in the business aspect and help the members of the Remote Village Project who do not speak Spanish. If you're more interested in health and providing health care, you can volunteer as a teacher in one of the health clinics, where you would just teach basic sanitation, basic treatments, and anything like that. Any donation goes a long way, whether it be time or money. I appreciate anything you can give, and thank you very much. Does anyone have any questions?